Hello, Mike Matthews, physical therapist here with the PT411. Thanks for joining me. If you already haven't done so, make sure you like and follow me on Facebook and Instagram. Make sure you're also subscribing on YouTube so you can be notified when I come out with future videos. So, hand stiffness, grip weakness, carpal tunnel syndrome, tendinitis, arthritis, tennis elbow, and golfer's elbow. What do all these things have in common? They all very well may. Not that they do every single time, but they very well may all have the same origin, the same cause, the same beginning. These all may be caused by the same very simple limitation that has a very simple fix if we get started on it right now. And this issue affects women so much more than it affects men, and I'll show you what the problem is and why right now. It's our distal interphalangeal joints. It's this joint right here that's highlighted in red on all of these fingers. Well, at least it's the distal interphalangeal joint on these 4 fingers, because we have 3 phalanx bones over here on all 4 of these. So we have a proximal interphalangeal joint, or our PIP, and our distal interphalangeal joint, or our DIP. On our thumb, since we only have 2 phalanx bones, we only have our interphalangeal joint, but the entire video I'll be saying DIP just to shorten it up. So what's the big deal about this joint? What makes this joint so important? It's not necessarily that it's so important on its own. It definitely needs to work in combination with all these other joints in our hand and in our wrist and forearm. But over time, it will stiffen up much quicker than any other joint in the hand, and it affects women. It stiffens up on women much quicker than it stiffens up on men. And the problem is, it's all because of your nails. You try to keep your nails nice and long, you pretty them up. Don't get me wrong, this video is not me trying to convince you to keep your nails nice and short. Keep them pretty, they look good. But the problem is, when we keep our nails nice and long, we protect them. We don't want them to crack. We want them to stay all nice and even, nice and symmetrical on each and every finger. So what do? Instead of gripping with both our PIP and our DIP joints, now we're only gripping with that PIP joint, meaning we're keeping those DIP joints nice and straight, and we're gripping this way right here, instead of gripping with all those joints right here. And what happens over time with any part of the body? Generally speaking, if you don't use it, you lose it. If you're not utilizing something fully in the body will not have any reason, any purpose to keep it going. And as far as joints go, if we're not moving a joint throughout its full motion, it will stiffen up. So over time, as we don't move that DIP joint here, it will stiffen up. So now you can't use this. So how does this turn into that long list of problems that I just talked about here? Let's start off here on this side. Whenever we stop using this joint right here, whenever it stiffens up, we stop using these shorter muscles that control our fingers. You'll see in the green right here, we have all of our short tendons, our short muscles that end up controlling all these fingers. Well, we also have these longer tendons and muscles that travel all the way through that wrist, going all the way up that forearm. And when we stop using these smaller muscles, these larger muscles have to work in overtime. So now we're working these quite a bit more going through that wrist. We can cause tendinitis more in this area right here. And it can travel up the forearm here to this common extensor origin. We have your lateral epicondylitis right here. All of these muscles up in here end up attaching right in this one spot up here on our elbow. When that gets strained, when that gets inflamed, we develop tennis elbow. That is exactly what can happen right here, all from this stupid little joint right here that loves to tighten up on us. And the same thing happens on the other side. When we don't use these small joints right here, we stop using these smaller muscles. All these bigger muscles up here tend to work a lot harder. Now flip all the way around here. Same thing here, our common flexor origin, our medial epicondyle. When that gets inflamed, when that gets strained, it causes medial epicondylitis or golfer's elbow. But if we work our way back up, you'll see another area up here that I have highlighted in red. You have several tunnels here made by soft tissue, several things that pass through, including these tendons and a nerve. And whenever we start pulling on these tendons excessively, it can inflame this area, including that nerve, that median nerve, turning into carpal tunnel syndrome. And if we go back to these little joints right here, when they stiffen up, other joints have to really overcompensate, and now you're excessively moving several other joints in here, and they can develop a lot of problems there. The hand gets very inefficient. We start to lose grip strength. Over time, we can start to have issues with writing and other fine motor activities. So we have this one very little joint that has a very common limitation that has the potential to cause a multitude of issues. And it's very easy to fix. It's very easy to avoid a lot of these issues when they're caused by this one little bitty joint and the stiffness that very naturally occurs to it. So what do we need to do? When a joint is stiff, we need to mobilize it. When it's already nice and healthy, to avoid it stiffening it up, we need to keep it mobile. We need to keep mobilizing it. And it's a very easy fix. It doesn't take long to work on. I do it every single day, multiple times a day. All you need to do here, push the finger straight back. We're gonna push it straight back this way. We're not pushing it down, because if we end up pushing it down, we'll end up hitting our PIP joint instead of our DIP joint, so we're pushing it straight back here. Get a nice good stretch out of this. We're only holding for a couple of seconds at a time, and then we're relaxing. And we do this 10 times. We can do this on each finger, but this will end up taking several minutes to do, so we can consolidate our time. We can grab on to all these fingers at once, and you're pushing back with the heel of your hand on your opposite hand here. So grab on here with all those fingers, press back, hold for a few seconds, and relax off. And I'm making sure I'm getting every single one of these joints here. Make sure you don't forget that thumb. Same thing, you're just pressing it back right here. Get a better angle here so you guys can see what I'm doing. So you're just pressing it in, making sure that you're mobilizing this joint, and you're not just pushing down this way to get this MCP joint right here. But not only that, once we get these joints mobilized, once we get them working, we need to make sure we're retraining all these small muscles in here to control these joints again, to control this mobility that we're getting back, because they're not used to it, our nervous system isn't used to it, and we're not going to recruit these muscles very well. So all we got to do is get a pen. Maybe we need to start with a marker or a highlighter, something bigger, to allow this to work early on before we get a full mobilization out of these joints here. We're keeping our knuckle joints right here nice and upright. They might have to bend and move just enough to get this working. But all you're gonna do here is roll that marker. I don't do this one as often, but I still try to get to it 4 or 5 days out of the week. You're only doing about a minute on each side. And every time you do this, you gotta make sure you get it mobilized right before you do this to maximize benefit from this one right here. So it's a very simple fix to a very small, simple joint to help avoid a bunch of issues that we can develop over time to our arm and our hand. Something everyone can start today to invest in the future of their health. Again, I'm Mike Matthews with the Physical Therapy 411. Make sure you're following, liking, subscribing, depending on wherever you're watching this from. Thanks for joining me.